I'm going to start by washing my hands, and I'm going to check my order. My order is for Robert Reed for today, right now, 9% sodium chloride, got it, through IV at 100 milliliters per hour. Okay, to figure my drop meter, I took 100 milliliters per hour times 10 drops per milliliter times 1 hour for 60 minutes. That gave me a total of 16.6 drops per minute, and you round that out to 17 drops per minute I will be looking for if I had to monitor, but most places require a pump that I would program 100 milliliters per hour to be administered. Okay, now that I washed my hands, I have my supplies. I have my sodium chloride normal saline tubing, saline flush, alcohol pads, tape for labels, and my gloves for when I hit the room. I'm going to go ahead and open my saline pack. I'm going to confirm that this is clear. It is not cloudy. It doesn't expire until January 22, so it's still good, and that is okay to use. I'm going to dispose of this. Now I'm going to go ahead and go through my tubing and open it. My tubing is 10 drops per milliliter that I will be using. That is how I figured out my also, that's how I figured out my drops per minute. I had to look at my tubing, and it is 10 drops per minute. I'm going to go ahead and open my tubing and dispose of all of this. The parts I want to keep sterile is this blue cap that will go into the well and the spike that goes into the bag. I'm going to go ahead and unwind my tubing. And I'm going to bring the clamp to the top. And I'm going to make sure I clamp this off. This way when we go over here and prime it, it won't continuously run. Okay. I'm going to go ahead with my saline now and spike the bag. I'm going to remove this tip, dispose of this, and I'm going to remove this blue piece, keeping all of this still sterile. I'm going to go ahead and insert the spike. Now I'm going to go ahead and prime it. I'm going to start by bringing this at least about halfway, and then we will hang it up. Okay, I'm going to go ahead and unscrew this, set this down. I'm going to go ahead and open my clamp. I'm going to reclamp it and check the line for air, making sure I check these Y sockets. There's no air there. Checking this one as well. No air there. And there is a little air in this one. So we're going to go ahead and clear that out. And then I'm going to go ahead and prime it again. And now I'm just going to give it one more check. And everything looks good. So we're going to go ahead, place this cap back on. I'm going to check one more time before I go into the patient's room. Again, Robert Reed for today. Right now is the time, which is almost 5 o'clock. 9% sodium chloride through IV at 100 milliliters per hour. Also, before I go into the room or when I go into the room, as long as these bags are labeled, the bags are good for 24 hours. I'm going to name, date, and time. My initials and today. And the time is 4:55. And I'm going to do the same thing for my tubing. But my tubing is good for 72 to 96 hours, depending on my facility. This is very important. That way the next nurse on shift or whoever knows when the bag or the tubing needs to be changed. So now I did my second check, labeled everything. I'm ready to go into the patient's room. Knock, knock. Hi, my name's Amanda. I'm going to be your nurse today. I'm going to go ahead and be changing your bag of saline that the doctor ordered for you. It's 9% sodium chloride. It will be going through IV at 100 milliliters per hour. It is for today at this time. And can I have your name and date of birth, please? And I'm just going to check that. Okay, Robert, that is good. It says you here that your allergies are listed as sulfa, but you have no worries today, for this doesn't contain anything of your allergies. Any questions or concerns for me? No? Are you having any pain? No pain. Any coldness, swelling, tingling, any concerns at all? No? Okay. So now I'm going to go ahead and wash my hands again. And I'm just going to put gloves on, and then I'm going to inspect your arm. Okay, I'm going to inspect here. I don't see any infiltration. There's no leakage. Bandage is dry and clean. There's no phlebitis, signs of phlebitis, no redness or swelling, and definitely no line marking up the arm through the vein. No extravasation, I believe, which is where the medicine will be leaking into the tissues, causing necrosis. I don't see any of that. And no signs of infection, no swelling, pus. It is not warm or cool, patient denies, and no pain. Okay, so now I'm going to go ahead and I'm going to change your bag. I'm going to open the saline syringe and dispose of this. We're going to prime this, making sure all air bubbles are out. Okay, we're going to go ahead and prime this. That looks good. And I'm going to go ahead and hang the patient's bag. Okay. I'm going to go ahead and open this alcohol wipe. And I'm going to prime the saline well for 15 seconds. Okay, I'm going to remove this cap. And I'm going to flush the saline well with only I'm going to turn this on, 3 to 5 milliliters only, just to flush. 1 milliliter, 2, and 3, and we flush that. Any problems with that? No? There's no swelling. I don't see any swelling after that flush. Still no leakage. Everything still looks good. I'm going to go ahead and dispose of this. And I know I did my third check, but I just want to make sure before I hang the bag. Robert Reed, I did check. Today, right time, right patient, right route, 9% sodium chloride, correct, at 100 milliliters per hour. Now that I looked at everything, I made sure the bed was safe. I'm going to go ahead and lower the rail so I can actually get in here and get to this. I'm going to take another alcohol pad. And we're going to clean this again for 15 seconds. And I'm going to uncap this. And we're going to connect this and twist this on because it's locking. It is connected. This is open. All clamps are open. I'm going to take this thing. It would usually go into a machine that would control the drops per minute. I do not have a machine, but that is the way it would do. Or it would be by my 17 drops per minute. I'm going to go ahead and open the clamp. And I would watch the drops. And I would stand here and time them. If I wanted to do 15 seconds, I would need to see at least 4 to 5 drops per minute and times that by 4 to get my total drops per minute needed. Okay, while that is open and going, I'm going to ask my patient if everything is okay still. Yes, still no signs of leakage or swelling. Bandage is good. Any questions or concerns for me? No? Okay, I'm going to go ahead and put the railing up. I did provide privacy. I did forget to mention it when I entered the room. I provided privacy to my patient. I'm going to go ahead and clean everything up. And wash my hands. Okay, sir. I put your bed railing up. I provided a call bell. I made sure the line is not kinked, that it is hanging. No air was introduced into my patient. Patient denied any pain. Everything went good. Okay, if you have any problems, you go ahead and you contact me or call me through the bell. Thank you. Open the curtain, close the curtain again, and leave.